Hello and Minglaba, welcome to MI Radio's Myanmar Today. I'm Henry Zin. COVID-19 cases in Myanmar have reached 146 with 5 deceased and 10 recovered. Elsewhere in Myanmar, Paungji COVID-19 Medical Center ready to tackle the rising number of COVID-19 victims. Chinese military medic delegation arrives in Yangon to help fight COVID-19. Strong earthquake jolted in Nay Pyi Taw about 180 years ago. All of that on this edition of Myanmar Today, but for now let's take a look at what's happening in local news. The Ministry of Health and Sports has issued the following order in a manner to exercise the rights contained in Section 21, subsection B of the Prevention and Control of Communicable Diseases Law. As the Ministry of Health and Sports is carrying out preventive measures against the COVID-19 virus in real time, people residing in some townships are required to stay at home in order to effectively control the spread of the disease. It is hereby announced that people residing in the following townships, added to the list from the previous townships in Yangon region, are included in the stay-at-home program: Mingladon Township, Tamwe Township, and Bordertown Township. People from the said 3 townships who are included in the stay-at-home program shall follow the ministry's rules, and the order went into effect from 10 p.m. on Saturday. With a view to strengthening measures to contain the spread of COVID-19 pandemic, the Ministry of Foreign Affairs of the Republic of the Union of Myanmar has issued the following announcements regarding the temporary entry restrictions for visitors from all countries which are in force till 30th of April. Announcement dated 15th of March regarding precautionary measures for all travelers visiting Myanmar. Announcement dated 20th of March regarding additional precautionary measures for travelers visiting Myanmar and temporary suspension of issuance of visa on arrival and e-visa. Announcement dated 24th of March regarding additional precautionary for travelers from all countries visiting Myanmar. Announcement dated 28th of March regarding temporary suspension of all types of visas, including social visit visas and visit visa exemption services. In order to continue its effective measures to protect the population in the country from the risks of importation and spread of COVID-19, the government of the Republic of the Union of Myanmar has extended the aforementioned entry restriction measures until 15th of May. In accordance with the directive of the Ministry of Health and Sports dated 11th of April, all incoming travelers, including Myanmar nationals, will be subject to 21-day facility quarantine and 7-day home quarantine on their arrival in Myanmar. Local authorities have set up 7 community-based facility quarantine centers in Molamyai, the capital of Mun State, to keep returnees from Thailand for 21 days. Uwe Linton, the administrator of Molamyai Township, said Myanmar returnees from Thailand are expected to enter Myanmar at the end of this month. A total of 7 places could accommodate about 2,800 people. There are now nearly 300 people under the community-based facility quarantine at the university dormitories. More quarantine centers will also be established in other 9 townships in Mun State for the returnees from Thailand at the end of this month. Bogor Region's police have reported 10 major crimes with 306 cases in 2019 amid police patrols and sustained enforcement. Bogor Region's police are conducting the strict patrol, immediate response to calls and follow-up investigations and law enforcement to reduce crimes. Last year's data showed 10 major crimes including 2 robberies, 12 murders, 4 burglaries, 6 animal thefts and 139 rape cases, totaling 306 cases. The 241 cases were filed lawsuits under the Penal Code, whereas 6 were closed. Regarding the drug trafficking, the police seized cocaine, ice, other drugs, and took actions against 236 convicted criminals under the Narcotics and Psychotropic Substance Law. As preventive measures, the police have carried out awareness talks about drugs at schools in the region for more than 100 times. They also conducted public campaigns about human trafficking. That's all for the local news. Let's take a look at the first report now. On Sunday, the number of COVID-19 cases in Myanmar have reached 146, 10 recovered, and 5 deceased. Doras was in reports.
According to the announcement issued by the Ministry of Health and Sports on 26 April, the number of COVID-19 cases in Myanmar has reached 146, including 10 recovered and 5 deceased persons. With the highest number of infections, 7 townships of Yangon have been placed on semi-lockdown, and now 3 more townships, Potatow, Tamui, and Mingkladong townships, have been also in semi-lockdown. Since the virus can't be yet kept under control, the government has issued to extend the restrictions on COVID-19 precautionary measures to 15 May, including a ban on mass gatherings and closures of schools and cinemas. Moreover, the positive patients were also found in Chin, Shan, and Kachin states, which are having difficult transportation with fewer resources than the big cities. State Councillor Aung San Suu Kyi, on the video conferencing with the frontliners of the Chin state, mentioned that the Ministry of Health and Sports is to spread the resources and professional health workers to cover across the country and to provide priority sport in remote areas.
After 30 April, a batch of Myanmar workers is returning from Thailand. The number of workers is about tens of thousands. After doing necessary prior tests, these workers will be sent back to their respective hometowns. It is impossible to place such amount of workers under quarantine in border area, so they are in all across the country, and the positive cases may be found in any place of the country. So the Ministry of Health and Sports is planning to be able to take immediate actions in necessary areas.
A National Volunteer Steering Unit under the leadership of State Councillor was formed to support the volunteers involving in fight against COVID-19. For the factories and workshops issues, on 20 April, the announcement was released to carry out inspections of the factories and workplaces to resume operation in line with safety health provisions. On 25 April, it was found out that one positive patient is the translator of one of the factories in Nay Pyi Taw township in Yangon. The translator, who is the case 144, already returned to Kachin state on 15 April, and the factory he works is reoperating with the approval of inspection team. After the test results on 25 April, the factory was instructed to be temporarily closed, and there are about 8,000 workers working at the factory.
2 responsible ministers have come to the factory to carry out necessary measures. Until 26 April, it is reported that there are 8 close contacts and 38 people living in the same dormitory. They are all now kept in quarantine. The Ministry of Health and Sports is to test them for COVID-19 as fast as possible. The remaining workers of the factory are to be put into home quarantine.
Yangon has the highest number of infections across the country, and Nay Pyi Taw township, with most of the grassroots and the working classes, is the most concerned area to contain the spread of the virus.
In Nay Pyi Taw, most of the population in the grassroots and the working classes who are not in the status of following the instructions exactly. For example, all the family members have to go outside to work, so semi-lockdown plan is not in effect well here. Even though we are carrying out COVID-19 preventive measures, it is not easy to cover all the fields of crowded population. Our township is struggling with livelihood of the grassroots and the health issues, so we are to speed up the necessary measures.
An automatic analyzer to test COVID-19 for about 1,300 people in 24 hours, which was donated by AA Medical Products Limited, is being installed in Yangon, and it is expected to start running in the first week of May. Moreover, to treat COVID-19 patients, the COVID-19 Medical Center, including 4 buildings, was constructed inside the Central Institute of Civil Service in Paungji, Leiku Township of Yangon. That's all about the latest update of COVID-19 cases in Myanmar until 26 April. This is Dora Susan from MI Radio.
That's a report on the COVID-19 cases in Myanmar reaching 146 with 5 deceased and 10 recovered. All right, we'll carry on with the next report. Under the guidance of the Ministry of Health and Sports, 68 COVID-19 patients are being currently treated at Webagi Specialist Hospital and 40 COVID-19 patients at South Oklapa Maternal and Children Hospital. Since these two hospitals in Yangon are likely to be filled with infected patients, the new victims are intended to be sent to the Paungji Medical Center. The transportation is arranged to take 80 minutes drive to Paungji COVID-19 Medical Center without any delay. Pyo Tivitu and Yenai will tell us more.
Paungji COVID-19 Medical Center, located at the Central Institute of Civil Services, Lower Myanmar, in Paungji Village, Legu Township, Yangon region, is ready to treat up to 2,000 positive cases. So far, Myanmar has witnessed a total of 144 patients. 108 of them are from Yangon, according to the Ministry of Health and Sport. Under the guidance of the Ministry of Health and Sports, 68 COVID-19 patients are being currently treated at Webagi Specialist Hospital and 40 COVID-19 patients at South Oklapa Maternal and Child Hospital. As these two hospitals in Yangon are likely to be filled with infected patients, the new victims are intended to be sent to the Paungji Medical Center. The construction of Paungji COVID-19 Medical Center includes an intensive care unit to treat the COVID-19 patient. The logistic operations are supervised by the Yangon region government, and the Ministry of Health and Sport is providing technical and advice and assistance. Dr. Pyo Tiha, Assistant Professor, Department of Emergency Medical Center of Yangon General Hospital, said.
Yangonမြို့လုံးမှာရှိတဲ့ဆေးရုံတွေက positive များထွက်ခဲ့လို့ရှိရင်ကျွန်တော်တို့ဒီ call center hotline ကိုဆက်သွယ်လိုက်မယ်အဲကြရင်ကျွန်တော်တို့ကနေပြီးတော့ကားတွေကိုသက်ဆိုင်ရာဆေးရုံတွေကိုလွှတ်ပြီးတော့မှတက်ဆောင်ဖို့လုပ်ထားပါဘောနော်
As soon as there are confirmed positive patients in any hospitals in Yangon, our call center can be contacted. Then we will arrange for the ambulance to dispatch the patients to the respective hospitals. We have to be very careful to carry positive patients. The transport team members need to strip and wear PPE suits in systematic manner. There is no time for delay on the journey too. We have been trained already for that, and the drivers are also trained to drive wearing PPEs. We are arranging that it will take 80 minutes to Paungji COVID-19 Medical Center without any delay. Depending on the conditions of the patients, there will be different ambulances with more or less medical workers. In case of the patient with ventilators, we have to assign one medical worker to them. The families of the patients are not allowed to follow the ambulance to Paungji COVID-19 Medical Center. Even the families have to follow the following instructions. There will be a group of responsible persons of defense services at the gate before Paungji Medical Center. Before the ambulance leaves the hospital, the patients and the families have to sign in the acknowledgement form. The Paungji Medical Center is in the restricted area and it is meant only for the COVID-19 positive cases. That's why no one is allowed to enter except the responsible peoples. They will allow only the ambulance to enter.
Dr. Deng Aunyo, Deputy Director of Yangon General Hospital, said.
တိုင်းဆိုရရဲ့လမ်းညွှန်မှုကျန်းမာရေးဝန်ကြီးဌာနနောက်ဆိုနိုင်ငံတော်တိုင်ပင်ခံလမ်းညွှန်မှုနဲ့ကျွန်တော်တို့ဖောင်ကြီးဆေးရုံကြီးကိုကျွန်တော်တို့ပြင်ဆင်ထားခဲ့ပါတယ်
Under the guidance of State Councillor Daw San Suu Kyi, the Ministry of Health and Sports and the Yangon Regional Government, we are arranging the Paungji COVID-19 Medical Center. At the same time, we are implementing to be an international standard transportation system. Yangon General Hospital provides the full facilities, including ambulance, and the Ministry of Health and Sports is also the same matter. The volunteers help us to drive the ambulances. Some volunteer teams are upgrading their remaining ambulances and provide for us. The Yangon General Hospital is supervising the transportation of the positive patients, and the ambulances are organized telemetric system.
Utuntun U, President of Yangon Rescues Organization, said.
ဆက်ဆက်လူနာရှိတယ်ပေါ့နော်တန်တရာလူနာအဲ့ဒီအတွက်ကိုတော့ကျွန်တော်လူနာပေါင်းအားလုံးအခုဆိုလို့ရှိရင်တော့ဒီနေ့ထိဆိုလို့ရှိရင်တော့300ကျော်လောက်ကျွန်တော်တည်ထားပြီးပါပြီဗျ
We've already had the experience of transporting around 300 PUI and suspected patients for COVID-19. But this time is different. We have to carry only positive ones on the long journey. So we are going to use the qualifying ambulance, and there is a rescue member in all selection. They are trained to have good dealing with the patient through nice personality. Regularly, the health condition of the member are fully checked up once in 10 days.
This is news reporting from Myanmar Radio. I am Pyodiritu.
That's a report on Panji COVID-19 Medical Center that's ready to tackle the rising number of COVID-19 victims. Stay with us as we bring you more reports on Myanmar Today. With the purpose of helping Myanmar fight against the COVID-19, a Chinese military medic delegation comprising medical experts from the military of the People's Republic of China arrived at the Yangon International Airport last Friday. They're going to stay in Yangon for 2 weeks and discuss with the medical experts from Myanmar's Defense Service at Defense Services General Hospital in Mingladon Township, sharing their experience and providing assistance in the process of preventing, treating, and controlling COVID-19. Here's the report.
With the purpose of helping Myanmar fight against the COVID-19, a Chinese military medic delegation comprising medical experts from the military of the People's Republic of China arrived at Yangon International Airport on 24th April. Upon arrival of the Chinese military medic delegation, they were welcomed by Chinese ambassador to Myanmar, Mr. Chen Hai, officials from the ministry, and the embassy staff. The Chinese military medic delegation members are going to stay in Yangon for 2 weeks and discuss with the medical experts from Myanmar's Defense Services at the Defense Services General Hospital in Mingladon Township, sharing their experience and providing assistance in the process of preventing, treating, and controlling against COVID-19. His Excellency Mr. Chen Hai, Ambassador of the People's Republic of China, said,
我们不会忘记，在中国爆发新冠肺炎疫情以后，缅甸军队迅速地提供了。
Defense Services of Myanmar has provided a great deal of assistance to China in the wake of COVID-19. We are unforgettable for their help, which is really worth it. As we see in the current situation, the laboratory confirmed cases for COVID-19 have been gradually increasing in Myanmar. So the Chinese military sends a military medical team together with complete set of medical equipment to Defense Services of Myanmar. We aim to support the fight against COVID-19 in Myanmar. We believe that it can enhance not only friendly relations between China and Myanmar, but also cooperation between the two defense services. The medical team sent by the Chinese government has already assisted to Myanmar, and 20 sets of ventilators also arrived at Yangon. We handed over all these medical supplies to Myanmar. 15 more sets of the ventilators are going to arrive soon. China will work closely with Myanmar in the fight against the disease.
Major General Tapo, commander of Yangon Command, said,
တရုတ်တပ်မတော်ကနေပြီးတော့ဒီလိုဆေးဘက်ပညာရှင်အဖွဲ့တွေရောက်လာခြင်းနောက်ဒီဆေးဘက်ဆိုင်ရာပေါ့လေကျွန်တော် COVID-19 အတွက်အများကြီးထောက်ကူပြုမဲ့ပစ္စည်းတွေရောက်လာတာအမှန်တမ်းကျေးဇူးတင်ဖို့ကောင်းပါတယ်ဒီပစ္စည်းတွေအားဆိုလို့ရှိရင်လည်းအခုအချိန်တိုတိုအတွင်းမှာ
We are really thankful for the arrival of military medical team with medical supplies from China. All these medical supplies are going to be distributed to all the required locations throughout the country. The Defense Service hospitals in Yangon are going to cooperate and discuss with the Chinese military medical team in the processes of preventing, curing, and combating COVID-19. Principally, we have 3 big commitments such as national defense, training and serving public interests. Each and every responsible military unit is serving the national defense duty and training duty as well. As a third duty of National Defense Service, we are actively participating in serving the interests of the public in cooperation with the healthcare providers under the Ministry of Health and Sports and the entire people as well.
The Chinese medical team also came together with medical supplies to donate them to Myanmar in the fight against COVID-19. I am Pyothi Ritu. This is news reporting from MI Radio.
Well, let's move on to the last report before we go to international news. With the support of the funds channeled through the Higher Education Department of the Ministry of Education, professors, students from respective geology departments of Hindata, Dangwu, Mongyua, and other universities conducted earthquake researches at the place where Sagaing Fault passed near the Union Minister's housing in Nay Pyi Taw from 2014 to 2016. Photographs of the sky were shot, and maps were drawn describing the Sagaing Fault. Lab tests were carried out after sending pieces of charcoal of the sediment resulting from the earthquake on Sagaing Fault to Singapore. Minton and Yenai report.
With the support of the funds channeled through Higher Education Department of the Ministry of Education, the professors and the students from respective geology department of Hindata, Dangwu, Mongyua, and other universities conducted earthquake research at the place where Sagaing Fault passed near the Union Minister's housing in Nay Pyi Taw from 2014 to 2016. The photographs of the sky were shot and the maps were drawn describing along Sagaing Fault. Lab tests were carried out after sending pieces of charcoal of the sediment resulting from the earthquakes on Sagaing Fault to Singapore. The earthquake research work showed that a severe earthquake rocked in Nay Pyi Taw about 180 years ago, said Dr. Myotan, Vice President of Myanmar Earthquake Committee, who is also a professor of Geology Department of Yangon University. Dr. Myotan, Vice President of Myanmar Earthquake Committee, said,
When we look back the past, the occurrence of fault earthquakes from the past to date has been found. The time of the earliest earthquake was not known, but that of last two ones was acquired by the carrying out of researchers. One of the earthquakes occurred in the length of 350 years. The earthquake occurs in the length of between 350 and 400 years. The last earthquake occurred in the span of 180 years. These 2 points we have already attained. The earthquake times have come from the laboratory tests.
So, these naku jong ya like that. Dagatu did na the dambo. Ngalin ye jong the dango. Konata quick and put Santa like the Kama Yare Yaladibo.
According to the lab test, the earthquake that rocked about 350 years ago measured 7.5 Richter scale, and another about 180 years measured 7.3 Richter scale. The strong earthquakes that have not jolt in Nay Pyi Taw, part of Sagaing Fault, has been more than 180 years. If the earthquake rocked, its intensity would be up to 7.3 Richter scale.
The earthquake will be more likely to rock in Nay Pyi Taw, part of Sagaing Fault, but the reoccurrence of the earthquake may be related to the time span. I don't mean the earthquake will exactly reoccur in 200 years. It means a period of time between the two events. If the earthquake measuring 7.3 Richter scale rock, a length of time would be 200 years. Also, it may occur earlier than 200 years.
Also, Tracer, Vice President of Myanmar Earthquake Committee, said,
A magnitude 7.3 earthquake is one of the strongest ones. If it is so, the size of losses and damages will be large. It can be said that magnitude over 7 earthquake, which do not occur in the country, has been quite low. It has been known to all that strong earthquake will be likely to happen along sky faults. There might be a large size of losses and damages if it was so.
In addition to the earthquakes research conducted in the Beijing, earth samples have been sent to the United States of America. Plans are underway to carry out a research in populous Yangon, full of tall buildings, hoping to begin in 2021, according to Myanmar Earthquake Committee.
And that's all we have for today's reports. Let's check on some international news now. More than 1,000 organizations and individuals, including charities, medical experts, and healthcare companies from around the world, have written to the White House arguing that the Trump administration should reverse course and keep funding the World Health Organization. The United States cannot rid this insidious virus from the country, nor around the world without WHO, read the letter, addressed to President Donald Trump and sent to the White House on Thursday night. Signatories include influential companies and groups such as the American Academy of Pediatrics, Oxfam, the Evangelical Lutheran Church in America, the American Public Health Association, and the healthcare company Kaiser Permanente. With many back to work and others still in quarantine, here are some basic tips for keeping safe and sound at workplaces.
Not everyone can work from home during the COVID-19 outbreak. And here are a few things to watch out if you have to go to your workplace. Masks are required to be worn all the time at work. And if possible, increase the distance between you and your colleagues. Keep the work clothes as well as seat covers clean and disinfect them regularly. Practice good hand hygiene. Avoid touching your mouth, your nose, and your eyes when you are not sure if your hands are clean. Wash hands frequently and correctly. Here's a video to show you how to wash your hands in the right way.
Wet your hands with water. Apply enough soap to cover your hands. Rub hands paw to paw together. Use one hand to rub the back of the other hand and clean in between the fingers and vice versa. Rub palm to palm and clean in between the fingers. Rub the back of your fingers against your paws. Rub your thumb using your other hand and vice versa. Rub the tips of your fingers on the palm of your other hand and vice versa. Don't forget about your wrists. Rinse your hands with running water. Dry your hands completely with the disposable towel. The whole process should be no less than 20 seconds.
Minimize hand contact with public facilities and regularly sterilize the work table, operating button, and office articles. Disinfect the surface and accessories of equipment operated by different people. And also, wear gloves when operating these equipments, if allowed. Avoid mass gatherings. Do not go to places where people gather, especially places with poor ventilation. Arrange different times to go to dining at the canteen or take the food back to your own working space. Keep a distance from others when eating. Pay attention to your health. In case of symptoms such as fever, fatigue, and cough, you should seek medical treatment in a designated hospital in a timely fashion while avoiding contact with the others. You should try not to take public transportation such as buses or subways and wear surgical or higher level protection masks on the way to and inside the hospital. For those who are service providers such as couriers, sanitation workers, drivers, custom personnel, salespersons, the police, and journalists, extra attention should be paid to protection. Prepare protective and disinfection supplies and do daily cleaning and disinfection. And when on duty, wear masks in a standard way. Replace masks that are deformed, wet, or dirty with a new one. Clean hands with sanitizer or soap and running water and take your temperature at least twice a day. Generally, it's not necessary to wear protective clothing. Remember, if your body temperature is higher than 37.3 degrees Celsius, you should stop working immediately and go to see a doctor.
How badly hit has Greece been by COVID-19? Greece reported its first case of COVID-19 in early March. As of Sunday, the country had reported a total of 2,506 confirmed cases and 130 deaths, according to Johns Hopkins University. Those numbers are a fraction of fellow southern European nations Italy with more than 195,000 cases and over 26,300 deaths, and Spain with more than 223,700 cases and just over 22,900 deaths. What do Greek leaders say helped them escape the situation in neighboring countries? Greece began enacting a lockdown within 2 weeks of reporting its first case. The country's health minister also credits quick action to form specialist scientific committees to advise the government on the best course of action early on.
They don't know when they'll be allowed to reopen yet, but staff at this clothing store in central Athens are getting ready.
Because we take the meter so quickly, I think we will have a very good summer for most tourists and for more companies here in Greece.
Greece began locking down within 2 weeks of its first case back in early March. With only a fraction of the coronavirus caseloads of many European countries, its government has won praise for its preparedness. From early this month, though, officials were warning any easing of restrictions would come gradually and wouldn't mark the end of the crisis.
Τόσο το επίπεδο της θνησιμότητας, όσο και ο ρυθμός αύξησής της στη χώρα μας φαίνονται ευνοϊκά σε σύγκριση με άλλες χώρες αυτή τη στιγμή.
Some are back on the streets in large numbers already, including these teachers protesting on Friday despite a ban on such gatherings. Greek economy is expected to contract sharply, but this cautious optimism acting early has paid off.
It came from outside, so if you have some measures to mitigate it, then you have a recovery after that. So what I want to say is that the depression is already behind us.
Nearly a decade since the start of its drawn-out debt crisis, Greece's economic prospects were finally looking brighter before the pandemic.
Hello everyone, but you are waiting for David.
And today it's Spain and Italy, not Greece, that's the focus of debate at European level over how to prop up weaker southern economies during this crisis.
Parce qu'elles produisent des biens qu'elles peuvent vendre vers d'autres régions. Si on abandonne ces régions, si on laisse tomber une partie de l'Europe, c'est toute l'Europe qui tombera.
Greece reported no new coronavirus deaths on Saturday, a further cause for optimism ahead of a lockdown exit plan expected next week. It may have been spared the worst of the first wave. Still, its economy can ill afford a second.
In other news, after White House officials shared findings on the effects of sunlight and common cleaning supplies on the coronavirus, US President Donald Trump raised the possibility of using heat, light, and injecting disinfectants to treat the coronavirus during a White House briefing, which has dumbfounded medical experts. However, Trump later said he was being sarcastic when he suggested injecting disinfectants to ward off the virus after the US Centers for Disease Control and Prevention warned against using disinfectants as a treatment method.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs, so it'd be interesting to check. I would like you to speak to the medical doctors to see if there's any way that you can apply light and heat to cure. You know, if you could. And maybe you can, maybe you can't. Again, I say maybe you can, maybe you can't. I'm not a doctor. I was asking a question sarcastically to reporters like you just to see what would happen.
The World Health Organization said on Saturday that there was currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second coronavirus infection. In a scientific brief, the United Nations agency warned governments against issuing immunity passports or risk-free certificates to people who have been infected, as their accuracy could not be guaranteed. It said the practice could actually increase the risks of continued spread, as people who have recovered may ignore advice about taking standard precautions against the virus. Well, that's all we have for now. Thanks for joining me on Myanmar Today. I'm Henry Zin. Wherever you are, please stay home, stay safe, help yourself to help the world. I'll see you again. Goodbye.